Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to those who are getting out and voting while following the 5 core actions. We have heard of many voting locations where people are spaced out at least 6 feet apart and wearing a mask. This helps to protect others, including those generous poll workers who are volunteering their time for this very important responsibility. We encourage everyone who hasn't voted yet to remember to practice the 5 core actions when you show up to the polls. 5 core actions. We will be holding another public flu vaccination clinic today at Victor Ashe Park from 3 p.m. to 6 p.m. Flu mist and flu shots will be available, but we will not have the high-dose flu vaccine at this clinic. Vaccines will be given to children ages 6 months and up, as well as older kids and adults. And the clinic will be walk-up only. No appointments are needed. And if you haven't received your flu vaccine yet, please make plans to attend today. Now, we'll move on to the local situation. We have 133 new confirmed cases since yesterday's report, giving us 12,059 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 573 probable cases. 11,225 of our cases are considered inactive, giving us 1,308 active cases. 442 individuals have been hospitalized at some point in their illness, and 64 Knox County residents are currently hospitalized. And unfortunately, we have 2 additional deaths to report today, raising our total to 99. And now we'll transition to the benchmarks. As a reminder, all of this data that we are going to talk about today is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Over this period, 10 flags were noted, with 7 of these flags, which were both yellow and red, on consecutive days. This indicates a continued increase in cases, and is why we are continuing to represent this benchmark as red. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test resulting reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents, and another for average time between specimen collection and lab report data. Over the 14-day evaluation period, 5 red flags were noted for lab turnaround time, with 3 on consecutive days. Over the past 2 weeks, lab turnaround time has gone down slightly from an average of 2.5 to 2.4 days. Regarding testing, we had 4 red flags, but only 2 were on consecutive days. Because of those factors, we are continuing to represent this benchmark as yellow. Sustained or increased public health capability is our third benchmark. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. With our current EPI support team, we continue to be able to initiate investigations in this desired timeframe. Because of this, our benchmark continues to be represented as green. I do want to take a minute to reiterate that in order for this process to work, we need individuals and businesses to cooperate. We continue to encourage everyone who receives a call from us to work with our team to provide the necessary information to help keep our community safe. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. During the past 14 days, there were 8 consecutive red flags for positive inpatients, followed by 3 consecutive yellow flags. Additionally, there were 10 consecutive red flags for COVID patients in the ICU and 10 consecutive red flags for COVID patients requiring a ventilator. These flags are based on our published metrics that illustrate statistically significant shifts in the data. After speaking with our hospital partners, they have recommended that the benchmark remain yellow because they continue to be able to manage the volume of patients that they're seeing. However, everyone should still continue to pay close attention to this metric and take it very seriously. These are still very high numbers for our region, and we are on the cusp of flu season when hospitalizations typically increase. Everyone should continue to practice the 5 core actions and get a flu vaccine to ensure our hospitals aren't overburdened. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve the community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. And then our 5th benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. Over the past 2 weeks, we have seen 11 deaths, with 7 in the last 7 days. The information available leads us to represent this benchmark as yellow. As we mentioned last week, with the increase in hospitalization, we expected to see the increase in deaths, and it's unfortunately what we are starting to see. Finally, under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, our 7-day trend line shows 21 cases per 100,000, and our 14-day trend line shows 22 cases per 100,000. The second chart shows the percent positive for COVID-19. This data is received by the Tennessee Department of Health, and our positivity rate is trending up, and the 7-day average as of Monday was 12.75%. I'll now open it up for questions.
All right. First question we have is from Alan Sims with Inside of Knoxville. Social media posts and comments on COVID-19 related articles abound, with people claiming suicide rates and drug overdoses have soared during the pandemic. Has that been the case in Knox County, and do we have comparative numbers to recent years?
We have looked at, we do get the reports for the overdose deaths, and we can look at that data. I do know we have seen an increase. As far as the adjective of soaring, I'd have to look at how much that increase has been. I don't have that information in front of me or in the front of my mind at this point, but I do know we've seen some increase in overdoses. Suicides, I'll have to go back and look at that. We don't get that reported to us in the same method that overdoses are, and so that's something we'll have to follow up with, and we'll do so with you, Alan. I'm not sure, and that data is not as real time for us to be able to get, so we'll do the best we can, but I wouldn't promise that we could do comparison data on that one in the same way.
Also from Alan, our case numbers, hospitalization numbers, deaths, and positive test percentages have all risen recently. Do you see this as the beginning of Knox County's toughest time so far, or a natural up and down? And also, what do you expect from November and December?
I think this is exactly what we've been talking about that we're concerned about. So you have a lot of things happening at one time. The weather's getting a little cooler, and that's going to move people indoors. And the more people that are indoors in close proximity, the more opportunity for spread there is. At a time when there's also just frankly a lot of fatigue with following the 5 core actions, and people are tired of hearing about this. But whether we're tired of talking about it or hearing about it, the virus isn't going away right now. And so we're very concerned about what's going to happen as we enter flu season, and with COVID still increasing at this point. And that's why really we want to encourage everybody to continue. Please get tested. Please follow the guidelines that we give you if you test positive, and help cooperate with our investigations so we can make sure that we try to minimize the spread as much as we can. And then for everybody else, try to completely follow those 5 core actions all the time. And so we can help minimize the spread of this disease as well.
From Megan with WBLT, the new plan for vaccine distribution released by the state says that vaccines will first be available to populations most at risk. What populations would fall under that category in Knox County?
Looking at I should say this is a draft state plan. There's still a lot of things that could change as we move forward with there's likely going to be several vaccines that we're working with, and there could be guidance that changes. But the plan as of right now, the first priority groups across the state, and we will follow it, are for those high-risk areas in the hospitals. So hospitals that have emergency department and ICUs and staff working in those areas, as well as our first responders. And we'll follow the guidelines in those plans, and we'll continue to work with our partners to make sure that we have plans to get that vaccine out from there.
From Bob Morgan with the Knoxville Liberty Press, when vaccines are available, will they come from the state health department or directly from the manufacturer?
That's all a little bit up in the air. We'll have to look at how that's going to work. But the state, I can say, will be coordinating the efforts of receiving those vaccines from the different manufacturers, and we'll be following their guidelines. Whether there's a pit stop at the state or not, we'll have to see how that works out with how the vaccine is distributed from those organizations.
From Laura Darnell with WATE, Knox County is almost to the 100 mark in deaths. What is the age range of those deaths, and are we still trending older?
We are still trending older. I don't have, I think we've seen deaths in most of our age categories except for the very young age groups. But overall, we are still trending older. And that's one of the messages, again, that we continue to try to put out there is while there's the young, healthy folks, are getting out and we see more cases in that population, there's still interaction with high risk people that can have more severe complications. And again, that's why it's important for everybody to follow those 5 core actions.
From Bob Morgan with the Knoxville Liberty Press, Integrity Labs has stated they are no longer processing COVID tests for KCHD. What is the current labs being used to process those tests? We look at lab turnaround time as our primary method and being able to get state payment for those labs as well. Primarily, we're using Path Group right now, and they also had some, and then the Tennessee Department of Health State Lab are our 2 main labs that we're using. Decisions on that, again, is based on turnaround time, so we can make sure to get back to people and follow up with them as quick as possible, and also access for the patients to be able to get their own results and have the information they need. So wanted to be most convenient for them. From Laura Darnell with WATE, a local restaurant recently posted on Facebook being critical of the health department, saying they are done wearing masks. What is your reaction to this post, and will there be any punishment for not following the guidelines?
I think that sort of thing is very unfortunate, given that all of our guidelines and recommendations are to try to protect the public, the patrons, the employees in all of these buildings. But I will also say that we continue to do the same thing we've been doing and we've been saying that we're going to do. And so trying to work with the businesses as much as we can, provide education and guidance on why it's important is what we will continue to do in this situation.
From Grace King with WBIR, you mentioned that we tend to see more deaths after hospitalizations. Is there any data as to what percentage of hospitalizations end in death?
We'd have to go back and look at what state and national numbers are. It's hard to do with the number of deaths we have to have trending data based on that. It's while it's 99 and that's a lot, and we don't want that to be the number. It is a harder number to be able to trend from. And so we can go back and look at state and national reporting on that. But we do know that we do see across the country and across the state as hospitalizations go up, a portion of those folks unfortunately will pass away, and so deaths will go up.
From Bob Morgan with the Knoxville Liberty Press, is it true that hospitalizations of COVID patients are compensated to the hospital at a sum of $166,000 out of the CARES Act funding, in addition to any other funds from private insurance and Medicaid/care funds?
I would direct any questions on billing to the hospitals. We don't work with that directly. My understanding, though, is that it's billed just like any other healthcare benefit. There's not extra funding that goes with someone being diagnosed to COVID with COVID-19, but I don't know all the details of how that's worked out with CMS and other insurance providers. So would direct those questions to the hospitals themselves.
Also from Bob Morgan, how much of the $7+ million federal funding earmarked for KCHD has been spent so far?
I do not have that number in front of me. We will have to get it and get back to you, Mr. Morgan.
From Brian Hornback, is KCHD receiving daily updates from Knox County schools, and has that curve flattened?
We are working closely with Knox County Schools every day. We actually have a team that works directly at Knox County Schools and with their team, and so we're in very close contact. It seems like it's leveled off, but we're also just coming back from fall break, and we know there's travel and all of the things that go along with that. So I think that I would recommend that we keep an eye on what happens over the next couple of weeks to see what goes on with the school cases.
From Bob Morgan with Knoxville Liberty Press. Board of Health Representative O'Brien stated at one of the Board of Health meetings that, quote, "It's not appearing with this 11 p.m. curfew, unfortunately, doesn't appear to make much of a dent in the hospitalization rate. Is it still personal gatherings at homes, in the park, or other places that get this and spread it? Or is it restaurants and bars? I don't know the answer at this point." How can the Board of Health conclude to close these businesses without any due process or factual evidence of clusters?
You have to, I can't speak for the Board of Health and what their recommendations and their decisions are. And so I would recommend that you send that through to the Board of Health for their response.
From Grace with WBIR, can you speak at all to who is being hospitalized for COVID-19?
Trying to think of what I have seen and heard from the hospitals recently. Again, it's pretty much across the board. We are seeing, again, not as much in the very young population, but the last data that I saw was there was a range of hospitalizations, but it was still tending towards the higher population or the older populations or those with higher or more comorbidities with what you see in the national trends was the last discussion that we had on that.
Bob Morgan with the Knoxville Liberty Press. What is the number we need to achieve to flatten the curve?
Well, that's a really difficult question to answer. And also flattening the curve at high numbers is still not a good place to be. And so the hospitals are still going to be impacted. And there's other things happening in the community that can also impact how the hospitals are able to respond and take care of our folks. And so those metrics are going to be discussed, though, as far as removing of ordinances and recommendations from Board of Health level, and we'll let them address those in their meetings. But I do want to say flattening the curve is good, and that's where we were early on. But as we've had community spread now, we really need that to come back down.
Any other questions? Please go ahead and submit them now. All right, I'm not seeing any other questions come in, so thank you all for your time. We will see you again next Tuesday. Hope you have a good and safe weekend.